Welcome to Health Activators with lifestyle medicine doctor, GP and longevity expert Dr. Alka Patel. This show will help you to discover a hidden health hacking code that unlocks your phenomenal potential for an outstanding health span, lifespan and wealth span. The show features candid conversations with celebrities, influencers and industry icons, real-life stories and cutting-edge health activating advice that other doctors might not tell you. Discover why now is the time to join the strategic self-care revolution and experience the profound effects this will have on your personal and professional success. Now, here is your host, Dr. Alka Patel.
Hi, hey, and hello, health activators. Today, I am so delighted to be in conversation with Dr. Shah. Now, Dr. Shah is a cardiac specialist in the US, and what is so unique about him is that he founded and built a complete cardiovascular service from scratch at the Portland Clinic over in Washington. And Dr. Shah, he's also the Chief Medical Officer for Aktiia. Now, Aktiia is what I consider to be a very innovative medical startup which is disrupting the field of hypertension management. So what they have is a very unique blood pressure device, which I am excited to share with you today. This is a device that my concierge members love to wear. So today I want to share with you the technology and the thinking that sits behind what I believe is a device that is revolutionizing the approach to blood pressure. So welcome to the show, Dr. Shah. Before we get into today's show, please do support today's show partner, Youth and Earth. Youth and Earth have a range of products that I love to use myself to supercharge my metabolism, to support my health, and to slow down cellular aging. Just be sure you click the link in the show notes for exclusive offers, which Youth and Earth are so generously giving for listeners of this show. Dr. Shah, Jay, welcome to the show.
Thank you so much for allowing me to be here. It's great.
Oh, I know this conversation is going to be a super important one. So let's just kick off. I would love you to share, just to start with, a little bit about you, your kind of background, and more importantly, I think, why you do what you do.
For sure. So I'm a cardiologist by training and practice. I've been in practice for over 10 years in the U.S. I did my training at Massachusetts General Hospital and Washington University. So very large, sort of massive academic hospital institutions. And then I started my career actually by going out and starting a practice from scratch. So quite a different direction from after that kind of training. But I started a practice from nothing and sort of built it up over 7 years to a very busy clinical practice and ran that for 7 years. And then had an opportunity to work at the Mayo Clinic. So I did that for the last almost 4 years and built out their complex aortic aneurysm program. And so that's been my professional background. And, after over a decade of seeing patients and one-on-one settings and seeing, them when they've had a complication or when they've needed surgery or when they needed a procedure or after some event has occurred, I really started thinking, well, how can I take all that knowledge and sort of expertise and skill set and apply it in a different way to prevent some of these, bad outcomes from happening and to help people, prevent them from having to see me or see someone like me after some event has occurred. Because almost always they would ask me when they come to see me in the office, well, doc, how could I have prevented this?
Of course.
And so I started looking and sort of went through this sort of extensive sort of exploration journey and ended up finding a role at a company called Aktiia, which is all focused on how do we optimize and manage better hypertension, which is the world's most common chronic disease and the primary input largely into most of cardiovascular conditions that I was seeing. So that role has allowed me to grow in a lot of different ways, but really focus on how can we take that knowledge that I've gained over a decade of clinical practice and apply it to hopefully a much broader population to achieve a significant impact.
Yeah. Yeah. Well, look, thank you for kicking off with that. I think you've dropped a few things in there. I know you very casually dropped in Massachusetts and the Mayo clinics, but just to let everyone know, these are incredible institutions and organizations, and with, amazing levels of expertise. So really just want to share where you kind of started from in terms of your level of expertise and input in terms of what you've been doing for those that initial decade, for sure, and your background around that, because I think that sets the scene for the direction that you're now going in. And I love that you've used two words in what you've just said. One is prevention and another is optimization. So I'm just going to challenge you a little bit on this, if that's okay, because for me, certainly when I use the word prevention, sort of part of it's got a bit of a negative connotation to it, as though we're living our lives trying to stop something awful happening. And it's not a really great way to kind of live a fulfilling life, is it? Hoping that nothing terrible happens. It's a bit like, and I'm sure you've kind of come across this as well in your medical practice, it's a bit like practicing medicine, trying to avoid negligence or trying to avoid a claim. It's not a great way to practice medicine. You want to be giving and serving rather than worrying about kind of looking over your shoulder. So what's your view on preventative medicine? And is there a better way of looking at this?
I think for sure. I think it oftentimes semantics mean a lot more than just the words that we say they are, right? And so, in the academic and sort of healthcare community, preventive health has always been a common term that's been used. But just to give you an example, it's not really backed up with action. So just as an example, in the US, 75% of all healthcare spend in dollars is on reactive events that happen in the hospital, usually resulting from chronic diseases. 3% of healthcare spend is truly on preventive healthcare. Yeah. And as you said, like, proving a negative is very difficult, or proving that nothing's going to happen is almost impossible. Usually something is going to happen. So I think it is a much more positive, affirming and empowering way to speak about it as optimization and empowerment. And that's, at Aktiia, that's how I've really kind of honed in on optimization and sort of patient-driven care as really core tenets of what we're trying to do. I mean, we've heard of patient-centered care in academic, medicine and healthcare for a long time, and that just really means focusing on the patient at the center, but still using the traditional framework of the traditional healthcare system to build around the patient. But really, for chronic disease management, when somebody is living their life 364 days and 23 hours and 45 minutes outside the physician's office or outside a healthcare setting, it's really kind of allowing or enabling patients to really drive and optimize their own healthcare for the long term. And how can we really help people to, first understand that, and two, build the tools for all of us to be able to do that.
Yeah. And that really is switching direction big time, isn't it? I mean, from your background, and I would imagine that there's some real kind of similarities between us, but I've sort of had to raise my hand at points through my career and say, I've become a drug pusher. And it's a bit of a hard pill to swallow, but the way we've been taught medicine very traditionally has been down this route, really laden with pharmaceuticals. And really what you're just talking about is just switching direction and getting to the root, like looking upstream beyond what happens at the end of the stream when everything starts to go wrong. And I think that is something that there's a craving for it in the population. But on the other hand, I don't think people know enough about this yet either, because these other routes still exist so strongly. Here in the UK, we've got the NHS, the National Health Service. There in the US, you've got your kind of streams. People are so used to going in this direction that when we're trying to pull them in a better way, it is really hard. I mean, how do you drive that optimization agenda? How do we make that something that is so profound and important and individual for people that that's something that they want?
I think so. First of all, to your point, I think that people want it, and there's a real need for it in the end anyway, especially in the US, and I know most countries in the world. There's a significant lack of access and ability to really gain what people term access to care, or a full, complete, comprehensive relationship with healthcare systems because they're so overburdened, understaffed, all these things. And the first thing that I think about is just knowledge. It's just giving people knowledge. It's not about medicine. It's not about procedure. It's not about driving towards some, lead generation for healthcare. That's not really the purpose. That's not why patients come to see us. People come to see us, and I take myself and my family to see a doctor because I have a question. I have multiple questions. Like, there's something going on. I just want information. And so one of the, real sort of aspects, at least at Aktiia, and I think the promises in digital health in general, is allowing people access to, very scientifically based and vetted information in a way that's digestible, accessible, and available to them at all times of the day, usually through some of their technological devices or whatever software we have. But it's really, bringing that information that we have in our healthcare centers and in our knowledge, and after all these years of training and work, and, opening that to everybody.
Yeah. Knowledge is a really interesting thing, isn't it? Because, like you said, knowledge is now so accessible to all of us. And in one way, we've all got the access to exactly the same knowledge through this little device that we all carry around in our back pocket. So knowledge isn't always the problem. As you say, it's the credible knowledge, but it's also then what you do with it. I mean, I know certainly when people have come into my consulting room, given them information, given them advice, given them knowledge. But what people don't do is they don't walk out of my consulting room and translate that knowledge into action.
Correct. Yes.
And I always talk about this is one of the biggest failings of the healthcare system is we keep telling people what to do, but we don't give them the tools that give them that empowerment, that belief, that opportunity, that ability to do it. So I do want to move the conversation on to, you've alluded to it already, data and devices and this other kind of realm of richness of information that we now have access to as well. So tell us about Aktiia and more specifically blood pressure and what this has done and changed in terms of kind of high blood pressure management and awareness.
So just some brief statistics on high blood pressure for listeners if they aren't aware. I mean, most people are aware that high blood pressure is a very common problem, but hypertension or high blood pressure affects 1.4 billion people in the world. It's growing at a rate of about 10% per year. It causes 18 million deaths per year. It's the world's most common chronic condition and the world's most common modifiable cause of death. So it's an exceedingly large problem with these huge statistics. But one of the things that breeds is a level of complacency. It's a human nature. Everyone has high blood pressure, or 50% of adults over the age of 65 have it. Everyone hears about it. Everyone understands that there's probably medications and they'll be controlled and no problem, really, right? And you can't feel it. There are no symptoms. And so it doesn't really drive a sense of urgency, but it's at the root of the world's most common problems of immediate causes of death. Yeah. So as you're alluding to, it's like not just the giving people information about high blood pressure and hypertension, but also what is their own personal situation and how does their own data really interact with that information in a way that gives them not only urgency to change something that is really life-threatening, but also an understanding of what they can do personally to make interventions. And this is sort of the broad scope. So Aktiia is building this platform. It's a combination of a device that we can wear, as well as software on your phone. And the data that we collect from this thing actually gives you a more continuous stream of blood pressure data. So you don't have to sit in one position to get blood pressure measurements. You just put it on, and over the course of a day, you get maybe between 25 to 30 readings of blood pressure a day. Over the course of a week, it's almost 200 readings a week. And then over time, you build a very complex sort of data set that's yours. It's individual to that person, to you. And then based on that data, we're layering around in the software behavioral tools, interventions that allow that person to understand not only what does their blood pressure data set look like, but what do their lifestyle interventions, how do they impact their personal blood pressure data set? And so that's really the tool that we're building. And, that's what we're really focused on at Aktiia.
Amazing, amazing. And the reason I say amazing is because I just want to maybe contextualize this a little bit, because as you say, we all have a blood pressure and many of us have a high blood pressure, but we don't even know about it. That number you alluded to, 1.4 billion, I mean, that's the tip of the iceberg of people who know, but there's also what's happening underneath that iceberg is people who are walking around with high blood pressure and they don't know until bang, the heart attack hits, or bang, the stroke hits. And that's the first time you ever realized you had high blood pressure. Why? Because you're not measuring it. Yeah. Because it's not convenient to measure it. You've got to go and put your arm in this machine, which you might find in your doctor's surgery or maybe in your pharmacist, or you might need an appointment to go and do that. And so what you've done, what Aktiia have done, is bought the convenience and the safety and the efficacy and the ability to really take charge of knowing what's going on with you and then utilizing that information. And I think that's really important to contextualize, is that here we have something physiological going on in our bodies all the time, and yet we've not had a way of paying attention to it until now.
Yeah, and I think that contextualization, to go a bit further, is that even if someone does have a cuff, which usually it's like a loved one has a cuff or they're in their doctor's office, you take one reading and it might be a little high, might be normal, and it's very easy to just blow that off. It's very easy to sort of explain it away. Oh, I had more coffee today than usual, or I'm feeling stressed or anxious. I mean, this happens all the time. That's human nature. But what people often don't realize is that the concept of one stable blood pressure is false, meaning that one measurement at one time is not reflective of your blood pressure over the weeks, months, and years. Yeah. And that our blood pressure is continuously fluctuating, continuously changing. So to really get an accurate understanding over time of what your blood pressure pattern is, you require many, many measurements over days, weeks, months, and years. Yeah. And it gets to the sort of another critical point of blood pressure, is that blood pressure does its damage over long periods of time. It doesn't really matter generally 1 day, 1 minute, 1 week, even 1 hour, what is someone's blood pressure. That generally isn't that important. What's really critical is what is that blood pressure pattern over years, decades. And that's how blood pressure does its damage to all the different organ systems that it does. So having a tool to sort of continually monitor, track, optimize, and really show the effect of interventions on blood pressure over time is so critical. And that's sort of the core innovation that sits at Aktiia as compared to the standard episodic one-time blood pressure sort of measurement that we're all kind of familiar with.
Yeah. And thank you for highlighting that. I think that's a really critical thing to highlight and for people to know and add to their knowledge base, which is that one-off reading in itself doesn't tell you everything that you need to know. And we do have 24-hour blood pressure monitors and things as well, don't you? But they are incredibly cumbersome. And also the readings that you get. I mean, if you've got this thing pumping up your arm every hour, of course your blood pressure is going to go up because of it as well. And most people don't like to monitor things at nighttime and have machines on them at all. So let me ask you a little bit more about the device. Some people may be able to see that we're both wearing a little, what I describe as a piece of jewelry, really. It's a bracelet on our wrist, for a better word. It looks like a watch strap, right? Tell me a little bit about how this works, because there are going to be people listening who have used, the big cuffs or been to their doctors and had the cuffs. And how accurate is this thing on your wrist that looks like a bracelet?
Yeah. So it uses it works a lot differently than the traditional sort of cuffs do. There's no physical squeezing or compression of your arm. It sits on the back of your hand and wrist. And so what it's doing is using light sensors, LED lights, to shine a light into the skin, get a reflection back into optical sensors, and create these waveforms. And the waveforms are analyzed. That's what our founders really developed over almost 2 decades of work. Analyze these waveforms and deliver back a blood pressure and heart rate measurement, both to your device and to your physician via a dashboard at the same time. And so we've done extensive validation on, it's all published, all on our website, and we have extensive validation on our device as compared to the gold standard, which I can go into. And it is in the seated and relaxed position, it meets the standard criteria for accuracy of a cuff. One of the, I would say, intricacies of blood pressure measurements validation is that all cuffs have only been validated in one position. Seated, relaxed, back against a chair, feet against the floor, no talking, no drinking, no eating for 30 minutes, nothing on your arm. Your bowel should be empty. Your bladder should be empty. You should not have kids around. This is very sort of controlled environment. That's the only environment and position that cuffs have been validated in.
Right.
So our bracelet takes measurements when you're standing, when you're lying down, if your arm's over your head or down by your side, and we have validation data across every body position. And so it doesn't take it every second or every minute. If someone's running or walking or very physically active, it's not going to take it because you're going to have degradation of the signal. So it waits until you're relatively still before it takes a measurement, and it has a complex algorithm to determine those accurate times. And so that's how generally it works. So very passively and automatically, all you have to do is put it on. You'll get these sort of trends of blood pressure readings over days, weeks, months, and without having to do anything significant.
Yeah, completely effortless. And I think the fact that you're describing evidence and validation, and I've had a look at all of that, it's so important, I think, to give people the reassurance that this is accurate, and it's accurate enough, and it's as accurate as the other forms of blood pressure monitoring that you'll have come across. I think some of the data I read was around sort of about 7 millimeters either way, 7 millimeters of mercury, which fits within a gold standard. Is that right?
Correct. There's a very standard sort of criteria to get validation, and this is a Class 2A medical device, so it has to undergo regulatory approval by the regulatory bodies in the UK and the EU, and we have regulatory approval across both. And yes, for them to approve it, we have had to show that we meet the standard criteria for blood pressure devices.
So in terms of the sort of the population of people that you see wearing these sorts of convenient devices, wearables, is the device being used more for a population who have high blood pressure, or is it more of a screening tool to sort of check in to see if you've got it, or is it for people like me and perhaps you who don't have a diagnosis of blood pressure, are not worrying about their blood pressure, but really want to optimize health? Live well, live long.
All of them across the board. Right. When we look at our real world users, I mean, it's not, sometimes people kind of assume, okay, it's a technology, it works on with a smartphone. This is going to be relatively younger people, more sort of healthy, sort of proactive people. Actually, it's not the case. We have a spectrum of people from young 20s and 30s all the way up to 65. Actually, most of our average patients are between 55 and 65, 70. Now, we've just recently expanded our validation to up to 85 years old. So now people up to 85 can use it. So, and we often get inquiries from caregivers, usually. A lot of times they're the ones who have set up the device for a loved one, an older person. That they're taking care of. So we see the spectrum from well-intentioned but healthy relatively, and they just want to optimize their health and be proactive, through people who've had an event and now really want to take charge of their blood pressure and understand it better, and really want to have a much more comprehensive and easy to use solution. So I have to say it spans the spectrum completely.
Great. And I also have a number of clients who have a family history of strokes, heart attacks, early heart attacks, early strokes. It's something that they don't want, so they worry about it in the back of their mind. And now they've got a way of monitoring and changing that risk and having that kind of much more earlier it's an eye into yourself, isn't it? Wearing devices like this, it's the idea of being able to watch yourself is incredibly fascinating, because, and we'll get into this, but it changes your behavior as well, doesn't it?
Yeah.
Right.
It does. And we actually have seen that. We've done some real world evidence sort of studies, just initial ones, just looking at people who bought the device, who gave us consent to kind of look at their data for research purposes. And we segregated out hypertensives versus normal blood pressure in the first week of wearing it, and then followed them for 6 months, just see what happened after 6 months. And the people who had hypertension did something. We don't exactly know yet what. They did something, and they lowered their blood pressure by a statistically significant amount, whereas obviously the normal blood pressure stayed normal. And I think it's preliminary evidence of the Hawthorne effect, which means just if you expose someone to their own data, they will internalize it and then take actions to then try to improve it. That, perhaps they went to their physician, perhaps they started an exercise program, perhaps they really looked at their diet or alcohol or whatever they did. And all it was giving them the data, the information that they could act upon.
Yeah. And I think we should highlight the Hawthorne effect. It's so powerful. We're talking about really the effect of being watched. So the moment you're being watched, your behavior changes. And we're now in this realm where you can watch yourself. Like, you don't have to turn your eyeballs inside out. Like, you can watch yourself with devices and data. And once you've got your eye on yourself, you do change. And I've got this with other devices that I use, sugar sensors, for example, with my clients. The minute you put one of those on, you just start, that self-awareness changes as well. So it's really interesting you highlighting that cohort of people that put the monitor on and something changed. We don't know what it is, but maybe it was just putting the wrist bracelet on that brought the blood pressure down itself, right? Yeah,
it could be just, who knows? But I mean, that's a significant impact just in and of itself.
Yeah, no, I love that. And what about interventions? Because just coming away from sort of the drug interventions for high blood pressure, just give us some more kind of lifestyle orientated interventions for people to take. They may have an Aktiia on their wrist, they're noticing some kind of fluctuations, things are edging up a little bit. What are your immediate suggestions for what to do?
So I would say the first thing I would say is that, even if we're going to go talk about the interventions and the things that people can do without medications, but the first thing to understand is that the impact of those interventions on the blood pressure isn't immediate. It's not like sugar or glucose where you can see an effect after a high sugar meal within like 2 hours. It's not like that. Blood pressure takes a little more time, whereas an intervention might take 1 to 4 weeks to really start showing some effect. And even one like weight loss may take 3 to 6 months to really see an effect. So again, the variable of time is so critical. Is that one thing that I've experienced in my patients have often told me is they get discouraged because they don't see a quick effect. They don't see an effect with some intervention within a week or two. But the truth is it takes much more than that. And so really looking at this over a longer spectrum of time is important. And if we talk about the interventions, the lifestyle interventions, almost all people could probably rattle off what physicians generally tell people what to do. It's like a laundry list of look at your, reduce sodium intake, reduce alcohol intake, reduce weight, exercise more, eat better, stop smoking, and sleep better. Okay. So this is sort of very generic laundry list that we give to all people. But here's the thing. Behavioral science tells us that if you give people 7 things to do, that each one of them is quite complicated and difficult to do, they're probably going to do none of that. Versus if you talk about 1 or 2 things that they can really focus on and really get a sense of, is it making a difference? Is it actually improving my overall blood pressure pattern? Can I see the results of this test sort of? Then it's much more impactful. And then they can actually know and be aware, okay, that for me, alcohol reduction is much more important than sodium reduction. And so I need to focus on that. And a good example of this is sodium reduction. Like we talk about sodium reduction all the time. Almost everybody can know, salt, generally high salt raises your blood pressure. And the recommended daily intake of sodium is between 2,000 and 2,300 milligrams of sodium a day. Average intake for a Western diet is 3,400 plus milligrams of sodium a day. It's really hard to reduce that because sodium's in everything. Salt's in all kinds of foods. So we talk about it ad nauseum with our patients, and I'm, do this all the time. But we also know that only 50% of people are salt sensitive for their blood pressure, meaning only half of the people with hypertension, even if they did follow a reduced sodium diet, will actually make an impact. The other half not going to have any impact.
Right.
So for 50% of people, we're talking about it, expending energy. They might be focusing on it. And for them, it doesn't really make a huge difference. So, it really is starting to try to figure out how can we tailor some of these lifestyle interventions to that person, and how can we do this sort of testing, like do dry January and see what happens with your blood pressure. And then we can know, does your level of alcohol intake actually impact your blood pressure? And maybe that's a major thing that you can focus on for the long term.
Yeah.
And so really kind of being very intentional about that, I think is important. And I think for behavioral science purposes, but also just to give people that sort of sense of ability to really make a difference, versus giving them 7 things to do that are so difficult that they'll never be able to accomplish any of it. And they just say, I'm just going to go back to my own life. And
it's so true. And you see this on social media. I see this on social media all the time, these listicles of 7 ways to do this and 12 ways to do this. And you know that you're not going to do any one of those, because behind every sentence is a lot of depth.
Huge depth. Yeah.
It takes so much to just change things. And I love this idea of self-experimentation.
Yes.
Fueled by this curiosity, but without the guesswork that goes with it, because you don't now no longer have to go, well, is it alcohol or not? Or is it salt or not? It's like, do the self-experimentation, enjoy that period of curiosity. Like you say, let's do dry January for a month, like monitor, see one intervention. Was it that? Wasn't it that? Okay, right. I've given enough time. I'm so glad you mentioned that, because we're in this kind of fast fix world, aren't we? Like, where's my results, right?
Yeah.
You've given it enough time. Do you know what? For me, that wasn't my thing. I know for my friend, when she stopped alcohol, her blood pressure dropped. It was amazing. But for me, it's really different. And I think that's the sort of dialogue we now need to start getting into. Okay, so now I've done the alcohol. I'm going to look up my processed food. I'm going to look at the and salt, right?
Let's look at that.
And the beautiful thing about devices and data and what they give you is we don't have to all be doing the same thing.
Right. Yeah.
And it's so personalized. And we've come back full circle, haven't we, to this idea of having a individual, personal, N=1 approach to health, rather than, I think what we've both experienced through our sort of early careers is this very broad brush population.
Correct. One size fits all. And and I think that is the real promise of this. And I mean, if you just think about it logically, everyone would say, like, if you're treating everyone the same, then obviously every single body is different. Every response is going to be different. And you're going to have, I would say, suboptimal results, which is exactly, generally what we've experienced with hypertension, with a global control rate of 20%.
Yeah.
So,
no, amazing. I'd love to know what you do for your own self-care, for your own health, for your own optimization. What's a day in the life of Dr. J. Shah like?
Well, I try to stay active as much as I can, which that means, walking a lot, walking in the US. I think it's a little bit more difficult sometimes in most cities than perhaps the UK, but walking a lot. I exercise. I use a Peloton. That's my thing. So especially when it's cold and wintry outside, I can just be inside and exercising still. So I use that pretty routinely. And then I try to eat well and balanced and, in moderation. I don't follow any real fad diet or fad sort of, approach, although they're not necessarily all bad. But again, it's individualized for different people. Mm-hmm. And I think for me I have young kids and a family. So, we all kind of eat the same thing, but we try to just, cook healthy, cook fresh vegetables, fresh foods, very low in processed foods, and don't eat out very much. Generally, that's what I do. And then I track, I monitor, I try to optimize for myself. And I think those are the main things. I think the other things that people probably don't think about for sort of happier and healthier lives are just social interactions, being plugged into a good community, having good friends, laughing a lot. I think those are so important, and most physicians don't talk about it. But I think as we get older, it's clearly becomes such an important part of our, mental health, which I think affects our physical health. significantly.
For sure. And, these are the very forgotten medicines, aren't they? Gratitude and kindness and connection and belonging. And there's lots more emerging data about the impact on longevity and health and physical and cognitive well-being as well. So equally important to look at as well. Do you track anything else? Do you collect any other data, or how do you use that for yourself?
So, I do. I track my weight. I think that's pretty helpful, and all of us can do that very routinely. So that's pretty easy to do. It's not exciting usually to track your weight, unless you're having good success at weight loss. But I do track it because I think it's really important. Obesity and being overweight is a primary driver of so many things that it is, and it's something that's so easy to measure or monitor at home. So I do track that pretty routinely. But otherwise, I'm not, luckily, fingers crossed, so far, I'm, staying pretty well and healthy. Yeah. And I do routinely get sort of the traditional measurements taken, blood work once a year. And I do those things fairly routinely for cholesterol and some other markers that I look at. Yeah. And then I just turned 40, so I'm going to get a calcium score, if you know what that is. I think those are super powerful and very, very helpful and predictive for cardiovascular disease. Yeah. So I in my practice, that's always been something that I've recommended for anyone who's at least over the age of 40, who's really, wants to understand their overall cardiovascular risk.
Okay. Well, now you've opened that up. You're going to have to explain to the listeners a little bit more about the calcium score and how you can access that.
Yeah, sure. So traditionally, when you start thinking about cardiovascular risk, it's exactly like we've been talking about. It's very population-based, age, gender, blood. Do you have high blood pressure? Do you have diabetes? Are you a smoker? Do you have a family history? And what is your cholesterol? And that's it. It goes into a database and it pulls from that database. Here, somebody like you with these numbers in this database, this is your general risk of a cardiovascular event in the next 10 years. So it's highly impersonal. It's just sort of database matching. But a calcium score is a very personalized test. And a calcium score is a low dose CT scan of your heart. So not much radiation. It's very minimal. And it's just looking for presence of calcium in the arteries of your heart. And calcium is a surrogate marker for plaque. So the more calcium you have, the more plaque you have in the arteries. And it has been shown many times now to be a very strong predictor of future cardiovascular events. So if you add this calcium score test to the traditional risk-based scoring, it becomes a much more powerful and personalized sort of risk assessment. And someone who might look great on paper, low cholesterol, not very old, doesn't have much comorbid conditions or diseases or other things, but has a high calcium score, has actually a significantly higher risk of future cardiovascular events. But they would not have known about that unless they did the calcium score. And it's a very widely available tool, and it's relatively inexpensive in the US. I don't know how much it costs in the UK, but in the US it costs $99. So most people, not all people, most people can afford that. And I'm sure in the UK, GPs or others can put in that order for a calcium score. And I think that's, for me, that's been it's a very powerful predictive tool.
Yeah. And that's great because it's all got sort of additive value, hasn't it, as well? And it's trackable. So these things are not just one-off things. You'd never just go and have a one-off kidney blood test, or you don't want to just have these things one-off. Once you kind of get into the rhythm of wanting to just get to know yourself, you want to be starting to monitor changes over time, because things do change over time, and sometimes you don't know until you start to measure as well, which is great. So no, thank you for sharing that. I think that's really useful from this kind of whole cardiovascular heart risk perspective, because heart disease still remains the biggest cause of morbidity and mortality, doesn't it, worldwide? Pretty much.
Yes,
so,
absolutely.
So Yeah, amazing. We should wrap up. We could carry on talking about this for a long time. I think you've shared some really important insights in terms of blood pressure monitoring, the time that we're living in now, what we've been able to access, creating some interest and curiosity and fun around health. Like, get to know your data. Let's start
Yes.
to enjoy what we know
Yes.
about ourselves as well.
Absolutely.
So any final messages for people listening, Jay?
No, I think that we've covered everything, and all I would say is that, really from my perspective, after sort of this career in medicine, what's become eminently clear is that healthcare is, what we have in healthcare is great. They will help. We can help people. We can help people when there's problems and events, but it always goes much better, and we always have a much better sort of outcome generally if people are really truly engaged in their own health. And generally, I've seen this time and again, if patients come to me and they're really empowered, they feel a sense of empowerment, like I can actually make a difference. I'm a partner with my physician in my own healthcare, not just relying on me or a physician or healthcare in general to kind of tell me what to do. The experience is much better for them, and they really feel, I think that empowerment really gives them some more confidence, like, okay, I'm really doing everything I can to optimize my health for the future. And it's not always perfect. And of course, there's no 100% prevention, but at least you're doing everything that in your power. And I think that's really super important. And I think I would wish that for myself and for all of us to feel that way.
Yeah. And that's such an important note to end on. It's that ownership, isn't it? Taking ownership of your health, empowerment, feeling empowered to do something about it, and also responsibility. Like, just have
Right.
that sense, this is my responsibility. It's not on anybody else, right? It's on me.
Right.
I get to choose, and
Yes,
we can
exactly.
make that easier. We can make those choices much more focused and targeted and strategic because we've now got access to incredible devices like Aktiia, which we can use. So thank you for bringing this to us, and we will certainly keep in touch. I'll put a link in the show notes in there as well for Aktiia to make sure that people can access what they need to when they need to as well. So thank you so much, Jay. This has really been an inspiring, enlightening, and empowering conversation.
Sounds great. It's great to be here. Thank you very much.
I hope you found that very informative. Now, next week, I'm going to be looking much more closely at blood pressure, and more specifically, the key areas in your lifestyle that you can modify to reverse and potentially get rid of high blood pressure. So I'll see you next week, and I wish you a health activating day.